Great. Good afternoon, everyone. My name is Mohammad Alhadj. I am academic clinician, chairman of Syrian Welsh Society, which is a refugee-led organization. But the best way for me to identify and to introduce myself is a voice of voiceless people. So first and foremost, before I start this presentation, I would like to thank both Peter and Pauline for giving me the opportunity, for arranging that for me, and for all the hard work done by Pauline for the group of experts of refugees. So, moving to my presentation now, how refugee-led organization can advocate for health and mental health and resettlement context or environment. That's quite an important story here. How can they be a key player in health and mental health issues? So let's start first with challenges in the resettlement environment. Refugees are a special subgroup of immigrants because by definition, their sometimes perilous migration history can put them at risk of number of health problems. So this is one of the issues when we talk about refugees in a resettled environment. Refugees frequently encounter barriers to care. Cultural mediation improves the quality of care for socially disadvantaged population. So this is very well known and identified as well. Without adequate primary health care, acute and chronic health issues can go unrecognized for refugees and got worse definitely. So these all like challenges identified in the resettlement environment. Now, what are the potentials with which such organization can take the opportunity and work and improve? So social accountability now, it's an important and new principle in medical education. So that's quite a good advantage for these organizations. Immigration can increase the cultural and linguistic diversity of the hosting community, which requires further tools to maintain diversity and cohesion. For that reason, there will be some resources which can be used in that context as well. Cultural mediation improves the quality of care for socially disadvantaged population. So that can be very much helpful point here actually as a potential from the other side to be used by these organizations. Now, what is needed to bridge the gap between the refugees and the resettlement environment? We need health advocacy and community-based education. We need direct engagement in a community shelter for refugees. We need activity relevant to the community through helping newly arriving refugees as well, those who resettle in that place. Also, we need building up the right database on health and mental health issues for the refugees community. Who's going to do that job then? It's a two champions job. So the first one, it's a championing healthcare professional from the hosting community or hosting country with a clear vision to understand the new issues and the ability to break the barriers towards inclusion in their system. Secondly, and this is our topic today, it's a refugee-led organization to provide advocacy and unlock the refugees communities to the new programs, new health programs in that hosting community. What refugee-led organization can do now, it's a channel for a two-way communication. They can identify the needs and the demands very early. They can explain the cultural sensitivities around the refugees community, and they can create a trusted bridge for refugees to inclusion in the hosting health system. So all the jobs can be done by a refugee-led organization. How refugee-led organization can do that? It can be done through engagement with a wider pool of NGOs in the hosting community to build up a local alliance to achieve their mission, local alliance of NGOs. Also seek advice from international organizations such as UNHCR, WHO, and that will help them to navigate through their rights and to learn about how to get some expertise from shared experience in the past. Last but not least, to engage well with their own communities and develop the right tools for that. Now, this is my story, which is the Syrian Welsh Society. And this is how we started. Started very early when I found myself as academic clinician in the heart of receiving and welcoming refugees, those who came to Wales. And this is one of my first engagement programs called Engage program. When I started to meet with these refugees, we had no tools at all at that time. It's just like a WhatsApp group. We connected with them, we put them together on that WhatsApp group. Gradually, we started building up that trust between us and among that community, and started talking to the National Health Service and started to use their resources. This is how we communicated with them when we provided resources to them with their own language. And how are we going to communicate to the wider pool of our community? We tried to translate to them all the resources and make that one feasible and available to them. Without that, there will be a language barrier which will continue for years and years and years. Now, how are we going to do it with our community? Is that only on papers, or is that a true engagement and going to the ground? And this is what we did. We went to the youth. We started like a youth program, a youth club, engaging with them, and that's quite essential to identify any mental health issues and any health issues in general. This is how we made engagement between them and the other hosting community, living together in a cohesion. This is how we made them sharing food, talking about their mental health issues and their experience as well in that hosting community. But is that a story only for youth? No. It's a story for everyone there in that community, including these newly arriving refugees, those who came with acute health issues, where we identified them and engaged with them in sport activities. And is that only the story with our community? It's bigger than that. This is what we do. We went to community centers. We spoke to them about public health check. We took Ramadan as an opportunity, and we invited everyone there in that hosting community and refugees community as well to come have a health check for blood sugar, blood pressure, weight, and any other acute and chronic medical issues. We used the mosque, which is a community hub. We opened the door for that one, and we welcomed everyone there. We made these stations, and we said to them, come and talk to us. And this is the place where we say to them, welcome to talk. Come and talk to us about your experience, about your issues. We use volunteers from the same refugees community, in addition to the wider community as well. And we made an open door policy. So although it's an activity for refugees, but everyone welcome from any other communities there and every component of that hosting community. So it's an open door policy. Now, can we do it on our own? Definitely not. We need friends and allies. And we went to organizations such as like Diabetes UK. We said to them, come and help us. Come and share your resources. Put them on the table. Let's just make that one available to these refugees community. Is that only the thing we can do just on the ground? There are people can't join us, but we can reach them. We can maximize the outreach by having these webinars and telemedicine as well and telecommunication. By having these webinars, talking to them, bringing imam from their own culture as well, who understands this cultural sensitivities, who can speak to them and advocate and support our message as well when we come as clinicians and advocate for that. But is that only the story to refugees in our community? Definitely no. We need to go above and beyond. We shared our experience talking about like Arab community and Syrian community, talking about other communities. We speak about Bengali, Urdu, other communities, and we made a national campaign. So from a small campaign, from a small WhatsApp group, we went above and beyond to something which can be used on a national level as well. And this is my above and beyond, when we shared resources, multilingual, in 8 languages, and this is the First Minister of Wales, when I launched that poster with him at Ramadan this year as well. And we say these resources should be available to everyone there in that community. 8 languages for all refugees from all backgrounds. And this is what we got. This is what we got, which is like a Marsh National Award for Mental Health, Peer Support, as a small organizations, started by funding from our own pockets. But more important than the money, it's the determination and the love and the passion to refugees as a voice of voiceless people. And this is how we celebrated again this one. The story again, playing sport every week with these refugees, sitting together with them, cheering when we complete 1 year with no stop of physical activity and mental health support. Do we need to do more? Definitely yes. And this is how we lobby to promote health and mental health for refugees. We go, we sit with the mayor, we speak to them, and we give our message. Are we going to stop there? Definitely not. We're going to invest more and more and more. And this is what we did last week when we went to the Parliament. We signed a pledge for mental health as part of the campaign Time to Change Wales. As a campaign to end the stigma around mental health, we signed that pledge. And I had a pledge as well from the Parliament that next month we're going to have an event to adopt the international pledge, which was announced yesterday, and that will be in a debate in the Parliament. So we went above and above and above and beyond, talking now about legislation, how a small organization can go to the Parliament, speak to the parliamentary people there, and leaving that one to be part of legislation. And what else? This is my last slide now. And the message will continue always with the smiles of volunteers. Without these volunteers, beautiful people there, the young generation, we won't be able to do anything at all of that one. We speak about funding, pledges, all that important. But most important to anyone working with refugees, to believe in these refugees, to believe in their case, and give them from their heart, from their passion, determination, as that will be the only way to achieve what refugees want and thrive for. Thank you all for listening to me.